Hello everyone, Dr. Matt Ed. Today we'll talk about bempedoic acid. Here is a flow chart of what other non-statin lipid-lowering therapy could be used for patients on maximally tolerated statin and their LDL is still not at goal. So if you go down the pathway and up to here, how much additional LDL cholesterol reduction does patient require? Off the bat, if it needs to be decreased by greater than or equal to 30%, then we could think about PCSK9 inhibitors. However, on this side, if it's almost there but just requires less than 30% reduction and the patient's already on ezetimibe, we can consider starting bempedoic acid in this population. The mechanism of bempedoic acid inhibits ATP citrate lyase. This is part of the cholesterol synthesis pathway, and citrate comes from the TCA cycle, also known as the Krebs cycle. And here, just a reminder that statins works over here by inhibiting HMG-CoA reductase. Indications for bempedoic acid include using as an adjunct agent if not meeting cholesterol goals with dietary modification, already on maximally tolerated statins, etc. It can be used as an alternative agent for those not tolerant to other lipid-lowering therapies, most commonly statins. And the dosage is 180 milligrams once daily. Bempedoic acid further reduces LDL by 18% in those already on statins. There is drug-to-drug interactions with simvastatin and pravastatin, so avoid those statins with this drug. And no dosage adjustment are needed for patients with renal disease. Some adverse reactions for this drug can cause hyperuricemia, as a result gout. So be careful in patients with history of gout, and it usually happens within first 4 weeks of treatment and can persist throughout treatment. So you can check uric acid levels in these patients pre and post, and can use uric acid lowering drugs. Another adverse reaction is tendon rupture. Can happen from weeks to months. If that happens, discontinue the drug, and patients can also complain about tendonitis, etc. And would avoid this therapy if patient has a history of tendon disorders or tendon rupture. So contraindication if they have hypersensitivity reactions to this drug, such as angioedema. With regards to monitoring, monitor lipid levels within 8 to 12 weeks of therapy initiation, so 2 to 3 months, and monitor signs and symptoms of increased uric acid, assess uric acid level as a result, and look out for signs of tendinopathy or rupture, such as joint pain, swelling, or inflammation. These are my references. If you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you for watching.